No one talks about vaginal discharge, but every woman should understand it, because sometimes it is completely normal, and sometimes it is your body asking for help. Many women feel embarrassed to mention it. They worry it sounds private. They worry it sounds uncomfortable. Some even worry their doctor will judge them. But let me say this clearly. There is no shame in asking about your health. I'm Dr. James Carter, a health educator, and today we are going to explain this in a calm, simple, respectful way. Now, let's begin with the most important truth. Vaginal discharge is often normal. It is one way the body helps keep the vagina clean. It can change during the month. It can look clear. It can look white. It may be thin. It may be slightly sticky. For many women, that is not a problem. So if you have discharge, that alone does not mean something is wrong. But what matters is change. A change in color, a change in smell, a change in texture, a change in amount, or discharge that comes with pain, itching, burning, or bleeding. Those are the clues your body may be giving you. Think of discharge like a small health signal, not something to fear, something to notice. Here's the first thing every woman should know. Normal discharge usually does not have a strong, bad smell. It may have a mild scent. That can be normal. But a strong fish-like smell, a very unpleasant odor, or a smell that suddenly changes should not be ignored. This can happen with bacterial vaginosis, often called BV. BV is not about being dirty. It is usually about balance. The vagina has healthy bacteria. When that balance changes, odor and discharge can appear. Some women notice thin gray, white, or watery discharge. Some notice burning when urinating. Some notice itching or irritation. And some women have no symptoms at all. That is why guessing is not always safe. A doctor can test and tell the difference. The second thing to watch for is thick, clumpy, or cottage cheese-like discharge. Many women connect this with a yeast infection. A yeast infection may also cause itching, redness, burning, or soreness. But here is the important part. Not every white discharge is yeast, and not every itch is yeast. If this is your first time, if symptoms keep coming back, or if treatment does not help, please speak with a healthcare provider. The third warning sign is yellow or green discharge, especially if it is heavy, foamy, bad smelling, or comes with pain. This can sometimes be linked with infection, including sexually transmitted infections. That may feel uncomfortable to hear, but avoiding the topic does not protect your health. Getting checked does. Doctors hear these questions every day. You are not the first woman to ask. You will not be the last. And a good doctor will not shame you. The fourth warning sign is discharge with pelvic pain. Pain low in the belly, pain during intimacy, or pain with fever should be taken seriously. This does not always mean something dangerous, but it does mean your body needs attention. Pain plus abnormal discharge is not something to keep secret or wait on for weeks. The fifth warning sign is bleeding. If you still have periods, spotting can happen for many reasons. But bleeding between periods, bleeding after intimacy, or bleeding with unusual discharge should be discussed with your doctor. And after menopause, any vaginal bleeding should be reported, even light spotting, even one time. This is very important. After menopause, bleeding is not something to explain away. It may be caused by dryness, hormone changes, or other non-cancer causes, but it can also be an early warning sign of a more serious condition. So please do not ignore it. Now let's talk about menopause. After menopause, lower estrogen can make vaginal tissues thinner, drier, and more sensitive. Some women notice dryness, some notice burning, some notice irritation, some have discomfort during intimacy, some may notice changes in discharge. This is common, but common does not mean you must suffer in silence. There are treatments your doctor can discuss with you. Many women think, this is just aging, but discomfort is still worth treating. Aging does not mean you should live with pain, burning, or fear. Now, let's talk about a mistake many women make. They try to clean inside the vagina. They use douches. They use scented sprays. They use strong soaps. They use deodorant products. But the vagina is designed to clean itself. Douching can wash away helpful bacteria. Scented products can irritate sensitive skin. A better routine is simple. Clean the outside area gently. Use plain water. Use mild unscented soap only on the outside, if your skin tolerates it. Avoid putting scented products inside. Another mistake is guessing from color alone. Color helps, smell helps, texture helps, but symptoms overlap. BV can look one way, yeast can look another way. ST can look similar. Menopause changes can confuse the picture. That is why testing matters. If symptoms are new, strong, painful, recurrent, or happening after menopause, please call your doctor. Do not rely only on home guesses. Here is a simple doctor visit checklist. Call your healthcare provider if you notice a strong bad odor, yellow, green, gray, or bloody discharge, thick clumpy discharge with itching, burning when you urinate, pelvic pain, fever, bleeding after menopause, bleeding after intimacy, or symptoms that keep coming back. And if you feel embarrassed, try this sentence. Doctor, I've noticed a change in my discharge, and I want to make sure it is nothing serious. That is enough. You do not need perfect words. You just need to start the conversation. Many women delay care because they feel ashamed. But your body is not shameful. Your health is not shameful. And private symptoms still deserve medical attention. Let's recap the 3 main points. Number 1. Vaginal discharge can be normal, especially if it is clear or white and has no strong odor. Number 2. Changes in smell, color, texture, amount, or comfort can be a warning sign. Number 3. After menopause, bleeding or unusual symptoms should be checked by a doctor. Most causes of discharge changes are treatable, but the right treatment depends on the cause. That is why testing is better than guessing. If this video helped you, please subscribe so you never miss an important health update. And please share this with a woman who may feel too embarrassed to ask. Sometimes one quiet conversation can help someone get care sooner. And remember, you are not dirty. You are not strange. You are not alone. Your body is speaking, and it is okay to listen.